Okay, this is the LightForce EXP. It's the best laser therapy system on the market. There are other systems on the market. There are people in my area who have other systems, namely an automatic robot that hovers over a body part, goes back and forth while he exits the room. The problem with that is that it only covers the part of the joint that it is exposed to, that the laser is over. In order to treat the entire limb or other parts of a joint, you need to reposition yourself, and that can be quite encumbering, and you can't fully ensure treating the entire body part or limb. Additionally, other systems are pulsed. This machine is 25 watts, and it can deliver 25 watts continuously without burning out any of its parts. Other systems are pulsed. They claim to keep it from overheating. Well, their system can't handle the continuous energy. My system can. And yes, you can apply 25 watts of continuous energy to a body part without worrying about it burning you, as long as you keep the wand moving. This has a massage head on it, or you could take the head off and hover over top of body part if the skin is too sensitive to tolerate anything touching it. This is the massage head right here, and there's other heads as you see right here. Okay, so this is not a pulse system. So when you get anywhere between, I don't know, 5 or 6 to 10 minutes worth of treatment, compare that to other systems which are pulsed. Other systems would have to be used for like anywhere between 30 to 60 minutes to get the joules of energy this provides within a short time period, like say 10 minutes, 5 to 10 minutes or so. So I'm going to demonstrate on myself. I had a quadriceps repair performed 5 weeks ago, and I'm using this to help heal and help with inflammation and to help improve my range of motion. I have very tense areas in my quadricep, and this helps loosen it up as I stretch. I also have a tight Achilles, and my left foot aches as well. So I'll demonstrate its use right now. Okay, you can see there are different protocols on here. I can choose height, body type, skin color, etc. I can pick a body part like my knee that I want to treat here, and I can choose the type of injury and then move on from there. And it gives a nice illustration of the body part, and it has prefabricated or pre-set up protocols. This protocol is for say 6 minutes. Now, what I prefer doing, at least for some of my patients as well as myself, is choose the operations mode, which allows me to use the full 25 watts at one shot, although some protocols might have that built in. This is, I'm doing a manual protocol. I can put in my own time, and this will ensure that I can get as many joules of energy into the tissues that I desire. Okay, so I'll turn this on. Okay. Okay, you see a red light. This is a target light. This is not actually the laser. I'm going to turn the laser on. Interestingly enough, you cannot visualize the laser with your eyes, but through this camera it actually shows what you can't see with your eye or your eyes. So watch what happens when I turn this on now. Okay, now it's emitting energy. Now I don't see that bright light that you see in the camera. I can only see it in the camera. I cannot see it without the use of the camera. I'm wearing very special protective glasses as well. Now you can see my scar here, 5 weeks post-op, and there's a lot of tension in here, a lot of tension over here. When I normally use it, I'm just demonstrating now, but normally I'll cover maybe like a card size area, go across it fairly slow. This is a full 25 watts being delivered at one time, and it's not burning me because I'm keeping it moving the whole time. The massage ball lets me get deeper into the tissues, and it really helps me improve my range of motion, helps with pain, inflammation. Okay, now normally I would continue and work on this for some time in one spot and not cover every spot that's on my leg at one shot. I would work my way through each spot diligently. Okay, and of course I got some tension in my Achilles from wearing a cast for a few weeks and a long leg brace after that for at least a week or two. So I can use it in all those areas of tension, as well as get other therapies to treat these areas as well. Okay? Now normally I'd spend more time on this, but I'm going to go back and just work on my knee for a while. You can see, I'm going to put this on hold for a second. 5 weeks post-op, I've got pretty good range back, and the laser has helped with that, as well as other things I've been doing in the clinic. Lost a lot of muscle girth with this procedure. Whole quads, complete tear. Had to have a knotless quad repair procedure performed. Okay. As I said before, we combine modalities. Or if I didn't say it, I'm saying it now. We combine modalities to get the best treatment. So along with this would come possibly ASTYM, ASTYM procedures, which involve augmented soft tissue mobilization to help with any potential for fibrotic tissue formation. I've been using Russian stim and electrical muscle stimulation to contract the muscle, manual therapy, therapeutic exercises, and the whole gamut. And I am ahead of the protocol. I am doing quite well overall, at least a few weeks ahead of the protocol. Now again, I'm jumping around just to show how it's used, but I would normally stay in one spot and spend a long time in that spot and not jump around so much. Okay, hope that helps. Have a great day.